SBAR is a crucial communication tool every nursing student must master, because you use this to communicate within various healthcare team. So let's go right into it. SBAR, the S stand for situation. Now, this is simply what is happening right now. Why are you calling your doctor? I want to call your doctor, you'll be like, hi, Dr. D. This is Nurse Sarah from the cardiac floor, and I'm calling about my patient, Miss Clara, who is complaining of increased shortness of breath, and our O2 sat is 88% on 2-liter nasal cannula. You've literally just given your situation, the reason why you are calling the doctor. You've gone straight to it. Now, the background, you want to give him more context. You want to, so that you can know what he's dealing with. You say, Miss Clara is a 78-year-old woman that was admitted 2 days ago for congested heart failure. She's on IV laces, 40 mg BID, that is twice a day, and her last dose was 4 hours ago. O2 sat at that time was 95% on 2-liter nasal cannula. You've given the background. Now the doctor knows what he's dealing with. Now let's go to assessment. When you're talking about assessment, is like your objective observation, because there is objective and subjective assessment. Subjective is like is the patient, they are the subject telling you what they are feeling, but objective is like you are assessing it, you are using your eyes. Now you go to your assessment. You say, after assessing Miss Clara, now she have crackles in her lung bilaterally, she's nervous, and her respiratory rate is 28. That's some information right there, because normal respiratory rate is 12 to 20. Our respiratory rate is high. You can go further in your assessment and say she has low urine output, 100 ml in 6 hours. That is very low. Mind you, this is a heart failure patient. She has congested heart failure, right? And if she's having minimal output, that means she's not urinating. What are you thinking? She's retaining water, edema in her legs, right? And from also your assessment, you said crackles. Crackles means fluids in the lungs. So if you say she has minimal urine output, 100 ml in 6 hours, and also you can say our blood pressure, after assessing the blood pressure, our blood pressure is maybe 102/60, our temperature is 37, which is okay, and our heart rate is 112. When you hear those two things, heart rate, when the heart rate is high and the blood pressure is low, always remember that could be signs of shock. Do not forget. You're gonna get some questions in necklace that will give you that hint that your patient's heart rate is high and the blood pressure is low. Shock. So that is your assessment, and then the last one is your recommendation. Now, this is like you suggesting that what can we do for this patient? You can say, I recommend us maybe assessing her for worsening congested heart failure. Maybe we should do more chest x-ray to see what's going on. And also maybe you can say, would you like me, because she's on 2-liter nasal cannula, remember, you can also say, would you like me to increase the oxygen, since the oxygen has dropped, right? The last time you said you observed was 95%. Now it's 88 as at the time you're calling the doctor, right? So your recommendation is you just suggesting what should we do for this patient to make their situation better. All right, I hope this helps anyone watching. Thank you.